You're trying to conceive a child, but not having much luck. Could there be medical issues preventing you from getting pregnant? How do you know when it's time for a basic infertility evaluation, and what can you expect? I'm Dr. Susanna Park, a reproductive endocrinologist and infertility specialist with the San Diego Fertility Center, and this is Preggie Pals, episode 72.
Is that a plus sign?
Pink or blue? Hospital or home birth?
What type of food should I be eating?
I think I just peed myself. I'm pregnant, and I have to exercise.
What pregnancy glow?
Wait, was that a contraction?
Gotta make these pants fit. I've got kinkles.
What do you mean there's more than one?
You've got the symptoms, and now you've got the support you need for a happy 9 months. This is Preggie Pals, your pregnancy, your way. Welcome to Preggie Pals, broadcasting from the Birth Education Center of San Diego. Preggie Pals is your weekly online on-the-go support group for expecting parents and those hoping to become pregnant. I'm your host, Sunny Galt. Have you joined our Preggie Pals Club? Our members get bonus content after each new show, plus special giveaways and discounts. You'll also get a free subscription to Pregnancy Magazine. Visit our website, preggiepals.com, for more information. Also, thanks to everyone who is listening to this episode through our awesome Preggie Pals apps. They are available in the Apple and Android marketplace. We're actually on Google Play now, as well as the Windows Phone. And this is the best way, in my personal opinion, to listen on the go, like when you're out pushing your stroller with your little ones, or perhaps waiting for your prenatal appointment. And it's absolutely free, so download our apps today. We do have some amazing panelists joining us in our studio, but if you're not local to San Diego, you can still join our conversation. And Stephanie, our Preggie Pals producer, is here to tell us a little bit more about our virtual panelist program.
Okay, so all you have to do is like us on our Preggie Pals Facebook page or follow us on Twitter. And when we record our shows, we're going to give you a little sneak preview questions, and you can be a part of our conversations from anywhere in the world.
Okay, if you're on Twitter, follow Preggie Pals VP, that stands for Virtual Panelist, and we'll be sure to tag everything with that so you can follow the conversation a little more easily. And there is more information on our website if you want to check that out in the community section, right? Be a virtual panelist.
Yep.
There you go.
There it is.
Okay, let's meet the panelists here that are able to join us in the studio. I guess Stephanie and I are considered panelists as well. I'll tell you a little bit more about me. As you guys know, I'm the host of the show. I am pregnant with identical twin girls. The due date is December 16th, but we are having the girls via C-section, and that has been set for December 2nd. So I'm crossing my fingers. I'll be 38 weeks. That's a long time to hold out for twins, but that's my goal date. I do have two little boys at home, Sayer, who is 3 years old, and Urban, who is about 15 months. Stephanie.
I'm Stephanie. I'm 30. I am a producer for Preggie Pals, and I have a baby girl, Savannah, who is about 8 months old. And other than being a producer for Preggie Pals, I'm a stay-at-home mom.
Okay, Destiny.
I'm Destiny. I'm 34. I am a physical therapist, and I specialize in pelvic floor dysfunction. And I am due November 2nd with a little girl. We decided to find out this time. We didn't find out with my son. It was a surprise, and then planning urges took over this time around. So my son will be 3 in October, and we are planning our second home birth with a midwife.
Okay, Jessica.
My name is Jessica, and I'm 29. I'm a medical biller, and my due date is March 8th, and we have one kiddo already. She's 8, and we're hoping for a VBAC this birth.
Okay, and Bridget.
Hi, I'm Bridget. I am 28. I am a nonprofit fundraiser and grant writer. My due date is December 19th with my first baby. It's a little boy. And we are planning a natural birth with a midwife in a hospital.
Okay, and Dr. Parker, I'm going to throw you into the mix here because I know you have a little boy at home, so tell us a little bit about him.
I am the mother of a 13-month-old boy who actually was conceived by fertility treatment.
Ironically.
I did not do it to myself. And he's doing great, and he's taking a nap as we speak.
My first was via fertility, Clomid, for my first. Anyone else have fertility go-arounds? No? Okay. This will be an interesting conversation. But first, we're going to take a quick break. Okay, before we get started with today's show, we do have a pregnancy app to review. This is an interesting app because it could help you get pregnant or not get pregnant. And it's all about tracking your fertile days. And the app is called iCycleBeads. And I downloaded the app the other day. And you know what I like about it is it's really simple. It's based on a product that they have, a bracelet basically that they have that allows you to really easily, be able to see when, your cycle started and therefore be able to predict your fertile days and your non-fertile days. Real easy to set up the app. You just download it to your phone, you select your cycle date, and then it gives you a nice little visual. You click, there's just a couple little options at the bottom. You can look at your calendar or get a visual of what they call cycle beads. And it literally kind of looks like, just a circle, and it's got different little circles within that. And, if you are in a brown area, that means that you're not likely to get pregnant. And if you are in a white area, then you are more likely to get pregnant. And of course, everything is according to date. So I'm picturing myself, out and about and, thinking, okay, is this a good day or not a good day? And it's just a nice visual, because what I've done in the past is put little X's on my calendar at home and then, try to follow it that way. But for me, this is a much more organized way of being able to view my fertility. But I wanted to get your ladies' feedback. So I know not all of you had a personal opportunity to test the app, but we did pass around some phones here in the studio so you guys could check it out a little bit. So Destiny, let's start with you. What do you think?
I like the visual. I actually prefer the calendar look than the actual cycle beads visual to it. The cycle beads kind of almost looks like what I've seen birth control pill pack.
Yeah, that is what it kind of looks like.
Yeah, it's like a birth control, and it doesn't have dates on it.
Right.
So I like I guess it does tell you which day you're on, but
it's harder to read, I think,
it's harder to
calendar.
read. I like the calendar aspect that you can just look on there and see where you're at in your cycle. It's also a good track. I mean, even if you're not really particularly caring about getting pregnant, I like to track my cycle just so I know what to expect and everything.
Mood swings and stuff like that.
Yes. So I can plan accordingly. So I think it's a lot easier than you said, like putting X's on a calendar or trying to keep track of it in your regular calendar app. So.
Okay, thumbs up, thumbs down. Would you recommend it to another parent?
Sure, thumbs up.
Thumbs up? Mm-hmm. Okay, what do you other ladies think?
I say thumbs up.
Thumbs up? You like it? You
nice,
think you could use it?
Easy, simple tool.
Bridget?
Yeah, I've used several fertility apps actually, because I tried for about 14 months to get pregnant.
Okay.
And I like the visual interface of this. It's really simple. I'd give it a thumbs up. But for me, I wanted something, when I'm actually trying to get pregnant, I want something a little bit more comprehensive. So something that has a place to put your basal body temperature, your other symptoms and everything. But in general, I think for most people that this would be a good app.
Yeah. Mm-hmm. Stephanie, what do you think?
I have also used other types of fertility apps, and I say thumbs up. I mean, it works. It tracks what it needs to track, and yeah, it could be more comprehensive. I mean, that could be a good suggestion to them, but I think it's good overall.
Yeah, overall, I would give it a thumbs up as well. A nice, easy way. Again, I like that it's on my phone. I don't have to track down the calendar system. I think it's only like $2.99 in the App Store, so it's not really expensive. It's something you can obviously use over and over again. The nice thing is a lot of people like that it tracks your cycles and it keeps that information. So if you want to go back and look at a previous cycle, sometimes, if you really are trying to get pregnant, if you're not completely like, oh, I'm always 29 days, I'm always 30 days or whatever, it's nice to go back and see what you were the previous month. So I did like that feature as well. So it sounds like we're all giving a Preggie Pals thumbs up. Okay, thanks, ladies. Today we are continuing our ongoing series focused on getting pregnant. Sometimes you try to conceive a child and nothing happens, and that could be a result of a medical issue. Here to tell us more about that is our expert, Dr. Susanna Park. She is a fertility specialist with the San Diego Fertility Center, and she's one of the featured experts on our shows. So welcome back to Preggie Pals, Dr. Park.
Thank you, Sunny. Great to be here again.
What should couples do prior to seeking help with infertility? Like, what should we be doing on our own before we say, okay, we probably need to see somebody?
So there's actually a lot of things couples could do before they come to see us, because the more information they give me, the better I can help them.
Okay.
And speaking of apps that we were just talking about, that's a great segue.
Okay.
So oftentimes patients will come to me and I don't have a history as to what their periods are like. So it's so helpful when they whip out their phones and they say, hey, look, here's an app and this is what my cycles have been like for the past 5 to 6 months.
Oh, great.
So number one is track your cycles. And it doesn't have to be an app, but something in writing. And remember, when we say the first day of your cycle, we consider that the first day of full flow, not spotting. So sometimes when patients come to me, I look at their history and they're counting spotting, but they spot for 3 days and then they menstruate. So it really looks like their cycles are so long, but they're really not.
Okay.
So one is track your periods,
Okay.
track when you ovulate. And sometimes you can tell when you're ovulating, but if you can't, you can buy an ovulation kit. Please don't confuse it with a pregnancy kit because they're always sold side by
They
side.
are, right?
I don't know why, but they are. And you had mentioned a basal body temperature. You can track that as well. Write on the calendar when you guys have sex because that's also important. Another thing couples can do is look at your medical history. If you're not medically healthy, make sure you go to your doctor, let him or her know that you're trying to get pregnant and get yourself medically healthy optimally. And another thing is get yourself in some kind of prenatal vitamin. And the truth is you really don't need a prenatal vitamin if you have a very healthy diet. But not everybody does. So what you really need is actually folic acid. And the minimal requirement is 400 micrograms, which is 0.4 milligrams of folic acid. But most prenatal vitamins have about 800 to about 1,000 micrograms. So it's a really good idea to get on a prenatal vitamin.
Okay. How long should we be trying to conceive before we? I mean, you hear the 1 year mark. I mean, is that pretty standard?
It depends on your age. So
Okay.
the standard is under the age of 35, 1 year of well-timed intercourse. Above the age of 35, 6 months. But having said that, it's really hard, I think. Let's say you're 28 and you've been trying for 10 months and you're not getting pregnant and you really start to get anxious. So one of the tests you can ask your doctor for is a blood test to see, hey, do I have enough eggs? And there's a blood test called anti-Mullerian hormone. It's a simple blood test you can do any day of your cycle, and it gives you an idea that, you know what, you're okay, you've got enough eggs. There's no need to panic yet. There's, of course, the well-known FSH that you do on day 3 of your cycle, which you should measure FSH along with estrogen. So those are 2 other hormones you can do, and that will then allay your fears that, oh my goodness, I'm running out of time.
Right. Okay, good. But nobody had to do this in here, right? No one had to wait and then seek fertility help.
Well, I didn't end up seeking fertility help.
Yeah.
At 6 months trying, I mentioned to my doctor that I wasn't successful in getting pregnant yet, and I was 27 at the time. I don't remember, something like that. And she did a blood test to check my estrogen levels, and they were normal.
Okay.
But we then discovered I don't want to invade my husband's privacy, but it was on his end.
Yeah.
He never went for fertility treatments, and then but he talked to his doctor and took Sudafed. Actually, it was. My husband's a diabetic, and so he had it was a complication related to his diabetes.
Okay.
And that's what eventually ended up working.
Yeah.
So we would have eventually, but we were pretty sure it was him and not me. So
Right.
that's why I never went in.
Yeah. So, Dr. Park, this kind of leads into the next question. What are some non-medical factors that could contribute to a couple's infertility?
So, interestingly, when I see a lot of these histories that patients bring in, sometimes couples have sex way too often. Really?
Can you blame us, though, really?
Men, are you listening?
Like every day for the whole cycle. I sit there and I'm shocked. And, the first month, it's funny, right? Oh, great. 4 months later, it's
my
not
goodness.
funny anymore. And they're tired of having sex. So, take-home messages. You cannot be having sex every day because if you do, by the time you're ovulating, there is no more sperm.
Yeah.
So
Okay.
But the other problem I have is the other extreme is people just work and they're tired when they come home. Right?
Yeah.
And especially if you and your husband work 2 different shifts, you're switching off because you already have kids at home and you honestly don't have sex enough. And that's really why you're not getting pregnant.
Yeah.
And then another factor, which I mentioned, but I mentioned lightly, is sometimes you so badly want to have that child that you have it worked in your head that you're so anxious and so focused on it that you're almost like shooting yourself in the foot. And I don't like telling my patients, look, you really need to calm down, because it's implying that their stress is causing it. But I do believe that your mental state really affects your physical state. And sometimes you just have to just try to be more natural about it and just sort of have fun.
Yeah. Which is hard to do if you've been trying for a long
very hard to
time.
do. That's
You feel like there's a lot of pressure.
Yes.
Especially if
Yes.
other people know you're trying.
Yes.
And it's like every month it's like, so,
Yes.
It's like once you pass your due date, then they're like, so where's that baby? Where's that baby? It's kind of the same thing, know?
Yes.
Yeah. Okay, so on average, what would you say percentage-wise of couples have an actual medical issue once they've been diagnosed and once they've gone through this evaluation, as opposed to just a timing issue? Because with my husband and I, it's kind of an interesting story. We tried for over a year. We could not get pregnant, and we started to seek the help of a fertility specialist. And we did, we did overall 3 rounds of Clomid, but it was 2 rounds, and then we had to take a break for just a month. And then the 3rd round is when we got pregnant. And then subsequently with our other pregnancies, they were pretty much not oops babies because we wanted to have more kids, but it was like, oh my God, we did this on our own. Like when we got pregnant with our second, we weren't trying, and we gave ourselves high fives. We're like, oh, we can do this on our own. So in my head, they did all the testing and stuff, which we're going to talk about after the break, and nothing came up. They couldn't, find anything. So for us, I really think it was a timing issue. We were blaming it on some sort of other thing, but really, how many people just can't time it right? I mean, because it is a very, and we talked about this in our last episode about getting pregnant. It is a pretty narrow window of time.
That's right.
Yeah.
That's right.
So what do you think?
So of couples trying to get pregnant, 15% of couples will find that they have a fertility issue.
Okay.
And of that 15% of couples, 85% will have a known medical problem diagnosed. So the vast majority will. So it's only a small set.
Right.
That it's just a timing issue.
Okay. Yeah. Interesting. Okay. Well, we're going to explore this a lot more when we come back. We're going to talk about what to expect during a basic infertility evaluation. So we'll be right back. Welcome back. Today we are discussing basic infertility evaluations, and Dr. Susanna Park from the San Diego Fertility Center is our expert. She's also a featured expert on our show. So, Dr. Park, let's talk about these appointments, first-time appointments, and it may be a little nerve-wracking because we already kind of feel that something might be wrong with us. It's a topic that's hard to talk about because it's related to sex, and that's always kind of weird and complicated. So what should couples expect at their first appointment?
Okay, so ideally it'd be great if both parties were present at the appointment, but you don't have to be. But if you come without your spouse, then try to get medical history on the spouse. So at the first appointment, what you want to get as a physician, I want to know, are there any medical problems contributing to the infertility? So medical history, surgical history, medications, social history. Do you smoke? Do you drink? Are you currently using drugs? What's your occupation? You may have a hazard at work that's actually contributing to infertility. For women, of course, your obstetric and gynecologic history. How old were you when you first got your period? Do you get a period every month? Do you have very painful periods? Have you had cysts? Have you had sexually transmitted infections? Have you had abnormal pap smears? So all those questions are very important. So really coming in armored with as much of your medical information as possible would be helpful. And then once that's done, I sit down and I basically go over basic reproduction, which may sound so simplistic, but it's amazing how many of us have not been educated on basic reproduction, basic female and male anatomy. So I go over that, and I go over how fertilization actually happens. And then I do an ultrasound to make sure there are no cysts on the ovaries, that the uterus has no fibroids. Then I sit down and I talk about just basic options. And it's just an information gathering session. That's all it is. Okay. And then patients schedule a follow-up visit just to go over test results.
Okay, so that kind of leads us to the next point, which is the testing that takes place. So, so we go to our first appointment, we talk with you, we talk about our history, and then from there, tests are ordered.
Correct.
And it's obviously different for men than women. So let's break this down a little bit. For women, what are some of the general tests? What do you do?
So for women, you want to focus on 3 organs: eggs, fallopian tubes, and the uterus. So the eggs, which I mentioned a bit in the past, is blood tests. So you want to do the anti-Mullerian hormone. You want to do on the 3rd day of your cycle follicle stimulating hormone, which is FSH. And you also want to do on that same test day 3 estradiol, estrogen. You also would like, and we do this at our practice, I don't know if it's done at every other practice, we do an ultrasound because we measure something called antral follicles, which is the number of little follicles you can see in your ovary for that month. So you use all those, the 2 blood tests and the ultrasounds to get an idea of what that woman's egg count is like. So these are only tests of egg quantity, not quality.
Okay.
And then to look at the fallopian tubes, you do a test called Hysterosalpingogram, which some people know as the dye test.
I did this.
You did.
I remember this.
And it has a bad rap because many patients complain, oh my goodness, it was so painful. And it is for some women, but it's not for all women.
It was, I personally experienced a little bit of cramping, but they told me when it was going to happen, and it was nothing. I've had menstrual cramps that are much worse. So
That's right. That's right. And then the 3rd test is to look at the endometrial cavity, which is the inside of the uterus, to make sure it's normal. And that can also be achieved by the same hysterosalpingogram test. So the hysterosalpingogram looks at both your fallopian tubes and your uterus at the same time.
Okay. All right. Now, how quickly can these tests be done? Like, are we trying to time this at certain times of our cycles, right?
Right.
How does this work?
So the hysterosalpingogram has to be done usually around between days 7 to 10 of your menstrual cycle, counting day 1 as the first day of full flow.
Okay.
And your hormone testing, the FSH and the estrogen, should be done around day 3 of your cycle.
Okay, what if a woman comes in and is very unclear on her cycle or hasn't been tracking it for a while, so there's a lot of question marks? How do you usually handle that?
Very easy, because these tests just have to be done before she ovulates. Okay. And most women who don't know where they are in their cycle are usually women who don't get regular periods, meaning their periods usually come every month and a half. And so for them, the timing doesn't change. It's the woman who says, I get my period every 2 to 3 weeks. That's the woman in whom you have to change the timing a little bit. But women like that know where they are in their cycle because they're constantly menstruating.
Okay. Now, and how accurate are these tests? Are these like 100%, or does it just give you a guideline?
It's a guideline.
Okay.
The egg tests are pretty good, but the hysterosalpingogram has a 15% false positive and false negative rate, meaning the test can come back positive and you still don't get pregnant, and then I decide, let's do this other test just to make sure things are fine. And of course, lo and behold, your hysterosalpingogram was wrong. So that does happen about 15% of the time.
Okay. So those are the tests for women.
Yes.
Okay. So let's talk about what the men go through.
Much simpler, of course. It's an unfair world.
I know, right?
So the men have to give a sperm sample. Okay. So But here's the issue. The sperm sample, there is a timing factor related to it. So the man should have ejaculated 2 to 5 days prior to the date of that sperm sample. And that's always very confusing. In other words, we don't want the man to have ejaculated the day before his sperm sample because then the sperm concentration will be lower.
Okay.
And we don't want it to have been a week since he ejaculated because then the sperm will be slower.
Okay.
So he should have ejaculated 2 to 5 days before the given date of his sperm sample.
Okay.
And he should go to a reputable lab. And what I mean by reputable is a lot of men, understandably, if the insurance covers it, they go to usually a Quest or LabCorp. And that's fine as a preliminary semen analysis. But these labs are not, people that are not trained to do semen analysis. And so if after that initial semen analysis, things are not going well, he should really go to a real fertility lab and get a real thorough semen analysis, because what you look for is the volume of the ejaculate, the concentration of the sperm, that is how many million sperm are there in 1 cc of the ejaculate, what percentage of the sperm is moving, And the most important factor is there is a strict morphology criteria called Kruger's, where you look at the shape of the sperm. So what percentage of a man's sperm is normally shaped? Because normally shaped sperm is what fertilizes an egg.
Now, why does it have to be a certain shape or whatever? Can you explain? I know we talked about this a little bit in that last episode we did, but why would a misshapen, for lack of a better term, sperm not be able to meet the egg?
Right, because in order for sperm to fertilize an egg, it has to bind to what's called a receptor on the egg. It's almost like a key in a lock. So if the key is not the right shape key, it won't fit into the lock and unlock the door. And believe it or not, the majority of sperm in a man's ejaculate is not normally shaped. And so you want at least 14% or greater in the most optimal condition of normally shaped sperm. And most men have perhaps 4% or 8%, meaning the majority of the sperm is not normally shaped.
Wow. That's really interesting.
Isn't that interesting? So among infertile couples, very often we'll see in the semen analysis that it's a sperm shape issue.
So it's less than what, 4%? Is that what you said?
Ideally, you want it above 14% normally shaped, but many men will come back at less than 14%.
Wow, that amazes me.
That's fascinating.
So it doesn't mean that they can't get pregnant. It's a game of odds, right? So that's what takes longer and longer and longer. But this is among an infertile population.
Okay.
But that's also what leads to survival of the fittest, right? We talked about this before.
That's right.
Like, those sperm won't work, but we're trying to get the best of the best, which everyone can pat themselves on the shoulder right now. We are the best of the best. We made it here.
I know, it's funny, like listening to all of these statistics and listening to all the things that have to go right. It's incredible anyone ever gets pregnant.
I know.
It's like, how does this happen? And how does it happen naturally?
I know.
And especially on accident.
I know.
Okay, so we do these tests. The tests come back to somebody like you as a fertility specialist who analyzes this, and then it's what do you do with these results? How do you piece everything together then?
So it depends. So if all the tests come back normal, it's a blessing, right? Because you can say, oh, shit, we're all fine. But it's also frustrating, right? Because then you sit there and you look at me and you say, so what's wrong? What are we doing wrong? We're timing it right. We're doing everything right. Why am I not getting pregnant? So you fall into a category called unspecified, meaning we honestly have no idea. We don't know.
See, that's what they did with us. They said we were unspecified, and it's a large percentage. What is the percentage that get put in that category?
It's about 15 to 20%.
Okay.
But here's the beauty of it, though, right? In a couple in whom everything is normal, conservative treatment is the way to go. Like Clomid.
Yeah.
Right?
Yeah.
Start off just small things.
Yeah.
Stay with the sex theme.
Yeah.
Just a little here and there.
The sex theme. I love that. As opposed to the Petri dish theme or something.
That's right. But as the tests come back abnormal, then I know, all right, the sex theme isn't going to work for these reasons.
Right.
So now we need to talk about more aggressive treatments such as insemination or in vitro fertilization.
Right.
But if the tests do come back normal and you've got enough time because your egg test is great, there's no reason why you need super aggressive treatment.
Right. Okay, so if one of your tests, and maybe it depends on the test, but do you have to like get 100% on these tests in order to, kind of fall into the category of you could still do this on your own? Or, if it's you flunk one, then, we really need to look at some outside treatment?
No, it depends on the test. So let's say she's 28 years old and his sperm's not the best, but it's not horrible, but honestly, it's not the best. But she's 28.
Right.
So I'll say to her, listen, let's just try some conservative stuff.
Yeah.
3 months, right? And if that doesn't work, then let's revisit this, and then we'll do something more aggressive to really address the sperm. But let's say she's 39, and his sperm's not so great. My tune is different, right? Because now she's running out of time.
Right.
And at that point, I'm going to say, look, we really need to address the problem here, which is really the sperm. But you're also running out of time. So now we need to talk about aggressive treatment because if I don't do this now, you may not have a chance in a year.
Right.
So there are many, you have to look at all the factors
Sure.
to decide how aggressive you should or should not be.
Okay. Well, and I know this naturally goes into a conversation about what your options are and stuff, but we need to hold off on that. We've got a whole other episode that we're planning to talk more specifically about Clomid, about IVF. I think we could do a whole episode on IVF. It's fascinating to me. But thank you, Dr. Park, for sharing all this information on our show today. It's always a pleasure to have you on Preggie Pals. We love it.
Likewise. Thank you for inviting me.
Well, for more information about our experts and panelists, you can visit the episode page on our website. And this conversation continues from members of our Preggie Pals Club. After the show, Dr. Park will shed some light on why some couples may initially have some trouble getting pregnant and then no problems conceiving future children, which was exactly what I personally experienced. So for more information on our club, visit our website at preggiepals.com. Before we wrap today's show, here's Jeanette McCulloch with some of the best online pregnancy resources.
Hello, Preggie Pals. I'm Jeanette McCulloch of Birthswell. We at Birthswell believe that you, as a mother, will make the right decisions for your pregnancy and birth when you have access to evidence-based information and a strong support system. That's why I'm here to share with you new media tools to find the information that's right for you. Today, I'm going to talk about a serious topic, but it deserves our attention. Most of us have heard of postpartum depression. But what we are learning is that mothers can be affected with a mood disorder at any time during childbearing and can include not just depression, but also OCD, anxiety, and, in very rare cases, psychosis. About 15 to 20% of all mothers and mothers-to-be experience some type of perinatal mood or anxiety disorder. If you or someone you know is struggling beyond the normal ups and downs of pregnancy or time after birth, the website Postpartum Progress is a rock-solid peer-to-peer resource. The site was created by mom Catherine Stone after her own struggles with postpartum OCD. Here you'll find information written in what she calls plain mama English, meaning no medicalese is spoken here. There's a comprehensive list of symptoms, including warning signs for when you need to seek immediate help. You'll also find information on treatment options, including those that are compatible with breastfeeding. Dads and partners, if you are listening, there's a section here just for you, too. Most importantly, when you're reading, you feel like you are hearing from someone who just gets it. Remember, this is a peer-to-peer resource and not a substitute for medical attention. You can find the site at postpartumprogress.com. You can also find Catherine Stone on Twitter. Follow the link from her website. Thanks for listening to today's tools for finding the information that's right for you, and be sure to listen to Preggie Pals for more great pregnancy tips in the future.
That wraps up our show for today. We appreciate you listening to Preggie Pals. Don't forget to check out our sister show, Parent Savers, for parents with newborns, infants, and toddlers, and our show, The Boob Group, for moms who breastfeed their babies. Next week, we are talking about episiotomies, tearing, and perinatal massage. This is Preggie Pals, your pregnancy your way.
This has been a New Mommy Media production. The information and material contained in this episode are presented for educational purposes only. Statements and opinions expressed in this episode are not necessarily those of New Mommy Media and should not be considered facts. While such information and materials are believed to be accurate, it is not intended to replace or substitute for professional medical advice or care, and should not be used for diagnosing or treating healthcare problem or disease or prescribing any medication. If you have questions or concerns regarding your physical or mental health or the health of your baby, please seek assistance from a qualified healthcare provider.